No, I mean, I'm sure they will be looking at that, but as far as we have seen from the sequence, we haven't been notified of any changes in the sequence itself to indicate that.
3 dead.
3 dead.
We are understand there's 1 Brit in the South Africa hospital.
Yes, he's in ICU. At the present time, we have 8 suspected cases, of which 3 have died, 3 have been confirmed, and these cases are all associated with the ship. We have 1 patient that is currently in ICU in South Africa who's actually doing better. We have 3 people that have today been medically evacuated from the ship and are on their way to the Netherlands. And we have 1 recent case that has been identified here in Switzerland, associated with the ship, but getting off the ship in St. Helena. And the last case is a suspected case, is an older woman who unfortunately passed away on board. All of this needs to be fully investigated. We don't have confirmation on this. So there's been sequencing done on 2 patients. So we only have confirmation, lab confirmation from 3 of the 8 individuals. So there are ongoing lab investigations. Only 2 have had sequencing done. This is really enough for us at the moment to, understand that it's the Andes virus. I have to say that since the beginning, we've been assuming that it is the Andes virus, just given the path of the ship, given that it started in Argentina and that it's been moving up the coast of Africa in the Atlantic. So it was an assumption that we had just based on, and as you know, hantaviruses are common in rodents and people can get infected with this, but there are many different types of hantaviruses. So that's why the sequencing is important. Every outbreak that we deal with in any infectious disease, we have incredible labs that work around the world with. And because this is Andes, we know typically most people are infected through contact with rodents or their saliva or droppings. But this one particular virus has been associated with some limited human-to-human transmission among close contacts and past outbreaks. That's important for us to set forth like the right public health measures and just to be very precautious with all of the people who are involved. Identified here in Switzerland, associated with the ship, but getting off the ship in St. Helena. For example, in this case, the husband and the wife, our working hypothesis is that they were infected potentially before they got on board. All of this needs to be fully investigated. We don't have confirmation on this, but our working hypothesis is that, and it's possible one of them was infected the other. They could have both been infected through contact with rodents, but we do know on board that there has been some close contact between individuals where we believe the virus is transmitted. So when we say close contact, we mean very close physical contact, whether it's sharing a bunk room or sharing a cabin, providing medical care, for example. Very, very different than COVID and very different than influenza. What type of exposure did you have to the known cases that we've had so far? And a ship is the plan is for the ship to move to the Canary Islands. Should that change, we will let you know, but that's under active discussion. We're also working with the Spanish authorities who have experience in this, who have incredible capabilities, with support from WHO and others, to make that plan. Specifically what you're asking, what will happen when the boat docks, what will happen with each of the patients, how will they be identified as higher risk, lower risk, to exactly have that plan. I don't have the details of what is exactly going to happen because that's currently being discussed. I want to be very clear in how we describe this because there's been so much attention to There is guidance that's out there related to that. That really needs to be discussed on what needs to be done. There is no decision to say they have to be quarantined for 45 days. I'm sure if people on the boat are hearing this or seeing this, they would be concerned as well. But the public health professionals, what they're trying to do is to make sure that if any of them are sick, that they're followed up and monitored and that they receive early clinical care because clinical care saves lives, but also to prevent onward transmission. So what we are working on is the guidance of what to do to prevent onward spread, and then the policy decisions are up to the member states themselves, and we're working with them to support them on what works best in each context. There may be different plans for those that are on the boat versus those that got off on the islands at different time periods, but it's very much a work in progress.